You are watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here on State Street. We're going to give you an inside look at what goes on in a compounding pharmacy. We're in front of LM Caldwell Pharmacist. And if you are taking bioidentical hormones, you may want to watch this program because not all compounding centers are doing the same thing. There's different mixtures, whether it's a troche or a suppository or a transdermal or a pill. My advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
Peter Caldwell.
Randy,
All
welcome.
right. For those of you just tuning in, today's topic is compounding pharmacy, and we have compounding pharmacist Peter Caldwell. So we're going to give them a behind-the-scenes look today.
Let's go back, Randy.
All right. Okay.
Welcome to our compounding laboratory, Randy.
All right. This is it.
This is where we prepare all of the compounded prescriptions that are ordered by the physician
So what is she
specifically for a
making?
patient. At this time, we're making a estrogen oral capsule specifically for a patient order.
So everything you're doing in there is compounding?
Yes, sir, it is. We have to specifically weigh out the exact amount of every ingredient and select the proper base for it to be in. For progesterone to be absorbed orally, it should be in an oil base. We use a peanut oil.
So peanut oil?
Yes. The progesterone product is an oily-based hormone, and so to be absorbed adequately, it should be in an oily base. If you use a dry powder progesterone, it's not as adequately absorbed. You know, we also make creams that you rub onto the body, either the forearm or the neck or the lower abdomen,
Okay.
and those have to be specifically prepared also in a particular base that enhances the absorption of the hormone or whatever the product is that we're using.
So what is she doing right now?
She's filling the capsules with the peanut oil and progesterone mixture.
Do you ever work in there?
I do occasionally. Most of our compounding is done by Dorina. She's an excellent compounding pharmacist, technician that has many years of experience and knows all the ins and outs of chemistry and pharmacology and how to prepare pharmaceutical products so that they are the best that we can make.
Now you compared it to a toffee machine on the boardwalk. Why is that?
Well, this is our window on the world. We allow the patient to come back here and watch how their prescription is made. It's
Do they actually come down the hallway and
Yes,
and
they
watch?
will come down and watch. We want them to. It's their prescription, and they can see how we actually weigh out their medication and prepare their formula.
Now, if you're just tuning in, we are in the lobby here at LM Caldwell Pharmacist, right here on State Street, and we're going to get a behind-the-scenes look. We promise them a behind-the-scenes look at what goes on in a compounding pharmacy. But more about your philosophy, because we've talked a lot off camera, and you like meeting with the patients, educating the patients. You don't get tired of that? I mean, you've been doing it for years and years?
That's the true practice of pharmacy, the ability to inform the patient and work with the patient to ensure that they have a thorough understanding of their medication and their treatment so that they can adhere to the physician's directions and become compliant with the medications that their physician has ordered. As a result, they will get the most out of their medical treatment.
Now, when I go to a pharmacy, it seems like the pharmacist is way in the back, and it seems like there's clerks in the front, and if I have questions, it's almost as if the pharmacist is too busy to talk. How do you find the time?
We're busy, but we do find the time. Patients have questions about their medications, and we're there to answer those questions.
Are there that many questions, though? It seems like people are taking the same medications for years. I mean, how many questions, can people really have?
Anytime there's a new medication introduced into their therapy, that's an opportunity for them to understand how that might react with medications they're already on. Also, if they've changed their weight, if they have added a nutritional supplement to their diet, if they're exercising differently now. This allows them the opportunity to speak with a pharmacist and get a comprehensive overview of what their whole medication regimen will be.
Okay, now how closely do you work with the physician, by the way? Because maybe a physician watching this, and they watch this program, are saying, I don't know if I want him that involved with my patient. Or maybe they do. Do they?
We work well with physicians. It's important that you understand that the physician and the pharmacist and the patient are a triad.
Okay.
The three of us have to work together in order to ensure that that patient receives the best medical care. The physician does the diagnosing, we do the dispensing, and the patient is the recipient of all of our knowledge put together.
Okay, now when I call you, by the way, it seems that you answer the phone or you're right there. You always answer the phone? No automated system?
No automated system. I try to answer the phone as often as I can, and I speak with my patients all the time.
Are people surprised? Patient calls and says, I want to speak to the pharmacist?
Yes, they are. And the offices are oftentimes surprised too when they ask for the pharmacist, and I tell them that it is the pharmacist. When they call LM Caldwell Pharmacist, they speak with the pharmacist.
Now, this is an old-fashioned pharmacy. Is that right?
It's old-fashioned in the fact that we've been here since 1947, but it's very current and very modern.
Okay, now terms like pharmaceutical care, what does that mean?
Pharmaceutical care is the philosophy of involving the patient in their patient care.
Okay.
Not just transferring a medication to them, but seeing that they understand their proper use of that medication and what to expect from that medication, and how they're going to develop as far as treating that particular condition. Randy, you know that oftentimes patients who take multiple medications have a problem with a series of different little all-white pills. So we have the opportunity to dispense our medications in different colored capsules and combinations of those colors to indicate what the medication is that's on the inside, and also to allow the patient to identify which medications that they're taking. We do this also with creams and with liquids by coloring them or putting flavorings in those products so that the patient can identify the product when they're taking it.
Now, we want to give people a behind-the-scenes look. So we're going to take our cameras, we're going to, I guess, go back there. Is that where you mix the
Yes, sir.
compound?
In our compounding laboratory.
Okay. And what type of things are you compounding here?
We compound whatever the physician orders.
Okay.
And many of our products that we produce are hormone replacement therapy medications, topical products from dermatologists or gynecologists. We have a lot of products for the neonatals and pediatrics, and for the geriatric patients who might have difficulty taking a commercially prepared product. We also do a lot of veterinary medications.
Now, one of the reasons we decided to cover this story, you told me on the telephone that you wanted the public to know that if they're getting there, that not all compounding pharmacists are mixing things the same. And I guess which means they may not be absorbed the same or as well. Is that right? Is that fair to say?
The important factors in compounding a prescription are not only the actual medication that goes into the product, but the form in which that product is used. There are many types of products which are absorbed better than others, and the vehicle or the base in which you put that product determines a lot of the absorbability of that product.
Now, without being negative against any other pharmacist, okay, and let's just say nationwide, are you saying that there are prescriptions, say hormones, things like that, that are being mixed with compounds that you would say are not the best way to mix them as far as to make them go into the body the best? Is that right?
There are certain vehicles that are...
Vehicles meaning what?
Meaning the base in which you put the product.
Okay.
And that will enhance the absorbability of the item to a greater extent than others. And the important thing with something such as hormone replacement therapy is that the physician do a thorough and complete blood lab initially.
Okay.
Prescribe a medication at a particular strength, have it compounded correctly, and then do a follow-up lab to see what changes occurred based on that prescription order.
Give me a specific example where the compounding pharmacist maybe mixes it with what you would think is not the best mix. I'm calling it a mix, or compound, I guess, for absorption.
Well, you can take a commercial product as an example. We have a number of commercial testosterone preparations available Some are labeled at 5 milligrams, some are labeled at 50 milligrams. Yet they both give the same amount of medication into the body.
Okay.
The reason for that is that the way the manufacturer makes their product, one product is 10 times more efficient at getting that medication into the body.
So same dose, but one's 10 times more efficient.
Yeah, same dose into the body,
Okay.
but there's more medication, more testosterone per unit in the product that is dispensed.
Okay.
So it is a responsibility of a compounding pharmacist to be consistent with their selection of formula to use and to have that product used all the time on that patient.
Okay.
So that the physician then has a standard by which to measure the results of their treatment. If a patient receives different compounded formulations from different sources, there's a very good chance that the yield or the amount of medication per dose is going to be different. Is all the hormone replacement therapy medications, the estrogens, the testosterones, the progesterones, if they're used topically, they will have a certain relative amount of absorption depending on what the medication is. If they're used sublingually, or if they're used as a vaginal suppository, or if they're used in some other form, if they're used as an oral capsule, there are some forms in which the absorption is very poor. And a physician...
Forms done by other compounding
or
pharmacists.
forms in themselves.
Okay.
And physicians must understand that there's not necessarily a direct relationship between a dose in an oral form and a dose in a vaginal suppository form, or a dose in a troche form to be dissolved under the tongue. The blood level is going to be different, and the physicians have to understand what value they're going to get out of each one. And by utilizing a common compounding pharmacist, that physician is going to be able to control their prescribing practice and be assured that each time they order that certain percentage of that particular product, they should expect to see a particular result from it.
Okay.
And the patient also should be aware of the fact that by depending on a trained and experienced compounding pharmacist, that they are going to receive the most effective formulation of product that they can possibly get.
If there's a mistake in the world of compounding, when it comes to compounding pharmacists, and you network with other compounding pharmacies, what do you think it is? People dabbling in it?
There are...
is it just what we're talking about? They're not mixing them with the correct... They're not spinning them enough? I hear words like spinning and things like that could make these things more absorbable?
I suspect that's probably true, is the actual compounding to the optimum value in the formula.
Okay.
Anybody can pour out a little bit of powder and stick it in a cream and rub it down and put it in a jar and send it out. But whether or not that product is going to yield the results that the physician and the pharmacist and the patient expect is up to the ability and the talent of the compounding pharmacist.
Okay. For those of you just tuning in, we are at LM Caldwell Pharmacist Wellness Center, and we're talking to Peter Caldwell. Today's topic, what goes on in a compounding pharmacy. Up next, you're going to see, we're going to take a quick break, but up next, I want to see you mixing some medications, kind of giving me a tour of what's going on behind the scenes. You're watching The Wellness Hour. We'll be right back.
Come on over here, Randy. Randy, these are examples of some of the mortars and pestles that were used in the past for
Shrunken
compounding.
down, obviously.
They're just little examples.
Okay. So you stock just about everything here.
We try to stock everything that we need to have for all the prescriptions the doctors order. Oh, Randy, I'd like you to meet my mother.
All right.
Mary,
Hi.
Mary has
How do you do?
Nice
been
to
with
meet
our
you.
pharmacy since the very beginning, and she does our accounting and business work for the pharmacy.
And in the old days, she would work in the front.
I like the people in front.
Okay. All right. Now, so Peter, when people come into your pharmacy, The compounding is done in the back.
Correct.
And you sometimes work back here? It's always in the front. You're always in the front?
I work here in the pharmacy. We're able to see our patients and talk with them and work with them right here. It's a very intimate relationship that we have with our patients.
So patients come in, and you say that you get involved in diet, nutrition, lifestyle things, supplements, but you're convinced that good nutritional supplements can make medications work better?
Yes, they will. And weight management, smoking cessation, limiting alcohol consumption, all of these factors are important for a healthy lifestyle. And the healthier the individual is, the better the medications that they might need for a specific condition, whether it's an infection or an ongoing long-term condition, are going to be much more effective.
Okay, now how often are you here, by the way? 5 days a week?
We're here every day. We're open Monday through Friday, 9 to 6, and on Saturday from 9 to 4. My pharmacy over by Cottage Hospital is open the same hours. At Saturday, they close at 1.
So you have 2 pharmacies here?
Yes, I
in
do.
Santa Barbara. Now, you told me this. You said, Randy, I've always felt that if people came in the pharmacy, they would keep coming here. Tell me about that.
Well, I think that the patients...
I mean, you did say that to me.
I did say that to you because I firmly believe that once a patient comes into our pharmacy and experiences the friendly, complete atmosphere that we have in patient care, that they will recognize the difference from any previous pharmacies that they have been using and will continue to be our patients for the added advantages that they have as a patient.
Now, what else are you doing here? We've talked a lot about compounding.
Well, Randy, one of our primary focuses at LM Caldwell Pharmacist is on the holistic approach to healthcare. I believe in my Called Wellness plan of...
Called Wellness.
Called Wellness.
Okay.
Naturally, everything for your good health is called wellness.
Okay.
I approach the whole life value by saying that the first point is diet. You have to put into your body what is good and put into the body what is reasonable for your body to survive.
I hate to interrupt, but I want people to know that if you're just tuning in, we're at LM Caldwell Pharmacist. We're talking to Peter Caldwell. He is the pharmacist here, the owner-operator here. And so I'll let you finish with your approach to wellness. Now, you're giving nutritional advice?
Yes, Randy. I believe that everyone should use a reasonable diet.
Okay.
They need to have adequate amount of fluids, drink their 8/8 of water every day. They need to do adequate amounts of exercise every day. Walking is probably one of the best exercises that people can do. But any exercise is good, whether it's isometrics or yoga or full exercise at a gym. You have to keep your body moving. The third level is nutritional supplementation.
You're high on that.
I believe that everybody ought to be taking a full formula, therapeutic level, high antioxidant, multivitamin, multi-mineral product as a baseline for their health care.
Now, I'm looking behind you, by the way, over your shoulder. I see a lot of different supplements, and it looks like it could be a little confusing. You helped put this together?
Yes, sir, I did. I think that the ability to enhance our body's normal function through natural products, herbals, nutritionals of all types are an important way in which to supplement our body's needs. There are products available which are specific for certain conditions, whether they're cardiac or diabetes or asthma or any number of conditions. The fourth level of called wellness is pharmaceutical intervention.
Okay.
Now, unfortunately, many patients take that and turn it upside down. They want to take a magic pill in the beginning and take care of all of their problems. This just won't work. You have to have a good substrate, a good physical condition in order for pharmaceuticals to work as well as they possibly can work.
Do you tell this to your patients that come in here?
Yes, I do.
They don't think it's a little preachy for the pharmacist to be telling them, by the way, to maximize the use of your pharmaceuticals, you need to take care of your diet, your nutrition, exercise. Is this your place?
It's very difficult for me to consider a heavy smoker who's taking an antacid or an acid blocking agent and not tell them that if they were to stop smoking, a lot of that condition would be resolved.
Okay.
Or the person who is obesely overweight and is having to take 3 and 4 different diabetic medications.
Okay.
That by losing weight, not only is their diabetes going to be more manageable, but more than likely their cholesterol and their high blood pressure and other issues are also going to come more into line. There are a lot of lifestyle changes that people can address that will make their prescription program much more effective, and they can possibly cut down on the numbers of medications that they take.
You see that happening?
We do see this happening because many of my patients understand this philosophy of healthy living and the relationship that it has to their medication profile.
Now, when we do a program like this, there will be people that will call, and maybe they have, and maybe you don't, I don't know if you want this or not, but if somebody calls you or comes into your pharmacy and they have a bag of medications and they're saying, what do you think? And should I be taking supplements that would help with this regimen? Do you want that kind of person to come in here? Do you have time for that?
If you can go onto my website, you can click on the consultation tab on the website, and it will show you what services that we offer in that area of medication management and the brown bag, such as looking at the person's different medications and determining whether or not the protocol is the best for them at this time.
So you welcome that?
Oh, yes, sir.
Now, if a patient's watching this and they're just 60 plus crowd, and maybe they're just taking a multi, like a Centrum, is that enough in your view?
In my view, I don't believe that the basic commercial vitamin products on the market are much better than just getting a bowl of total cereal. If you turn the package over on the back, you will see that they don't really have very much in them. The reason I say that a person ought to have a high antioxidant therapeutic level vitamin is that this gives us enough, this gives us a basic foundation of good nutrition with green foods and with trace minerals, all these important pieces to our diet that we should be getting in. We can add to that by having a healthy diet, but unfortunately nowadays it's difficult to find good healthy food in abundance, the fresh fruits.
So you believe that everybody should be taking supplements beyond what they would see at a grocery store?
Yes.
The supplements offered there. You handpick these supplements. You're sitting in front of a wall of supplements.
Yes.
Are these, in your opinion, better than what you would find in a grocery store?
I select lines of products based on the formulation and based upon the manufacturer. If you don't know who makes your product, there's no possible way that you can know what's in it.
Okay, now it sounds like you're trying to be nice, but would you say that these are better than what you would find in a grocery store, in your opinion? As far as multivitamins and things like that.
The products that I handle all have research behind them, documented studies to show the value that you get out of their particular product. There are not too many products that you can find at the local
grocery store,
corner grocery store that will support their product with documented research.
Okay.
And that's why the lines that I carry are all from companies that essentially are pharmaceutical companies that make natural products.
Interesting.
They're research-oriented companies, and they have well-supported clinical trials to show that their product will work and will give these types of results.
And by the way, we're completely out of time. I want to thank you for allowing our cameras in your pharmacy.
Sure, Randy, anytime. You're welcome here, and all of my patients are welcome here.
Now, I won't forget, one of my notes here said that you want to make sure that you really emphasize the delivery that you offer.
Yes, Randy.
With Lorenzo.
Lorenzo is our delivery man. He's a very pleasant individual who is very capable, and we have the opportunity to make deliveries to patients who cannot get out of their house or need to have their medications sent out.
Now, I'm going to read one of the things here from Sharon Mesh. She says, patronizing Caldwell Pharmacy is like stepping back in time when friendly, helpful, and competent service was more the norm. I always look forward to the task of fetching prescription refills at State Street. Goes on and on. Says, rather than rush, 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 I like to take a minute and chat.
She's typical of many of our patients. We do like to have that opportunity to become good friends with all of our patients.
I want to thank you, by the way, for allowing our cameras here.
Thank you, Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to know more about LM Caldwell Pharmacist, you can visit their website at caldwellness.com. You can also visit our website and see this interview again at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.